right. Hi, everyone. Good day. It's again Ezinne here with HSB podcast series, and we're going to be really talking about, the market and startup spotlights. And the very first market we're going to be spotlighting is Namibia this month. I think for many reasons, Namibia is one market that a lot of us do not know about, and we've underlooked the potential of that market, particularly in healthcare and other spaces. But I feel like Namibia is one market that's been growing. It's like on the ground that people have not been looking at. So today we have a very very interesting guest who is going to be sharing with us about the market in Namibia, and basically you know how the healthcare ecosystem in Namibia is changing and how you can support him. So I have with me today very very special guest in person of Jessé Liula. Jessé is the
Hi.
CEO and founder of Patient Care. And today we're going to be sharing about Patient Care as a person, as a company, as an entity, but also he's going to expose us to the market in Namibia. So welcome, JC. It's great to have you here. I just allow you to quickly introduce yourself and tell us about your journey and just briefly. Thank you.
Awesome. Hi, Ezinne. Nice to see you again. Thank you for having me. My name is Jessé Liula Schiceya, known as Jesse. And about me, well, I enjoy doing the boring things. I solve problems with technology, and in this space we're in, I'm solving the health problem with technology. I'm a computer scientist I studied computer science, and I've been an entrepreneur for over the past 13 years. And now in the startup space, which is pretty exciting.
That's amazing. Like, I wonder what made you go into healthcare with a computer science background. Why did you think about healthcare? And you talked about being an entrepreneur for quite a long time. So if you could just walk us through, the wider shift from computer science to entrepreneurship, then healthcare.
Right, cool. So let's start with history. After graduating, there were no jobs. When I graduated computer science, I came back home to Namibia, and there were no jobs. And with that, I then created a consultancy company. And with this consultancy company, I was providing web design services, mobile development services, digital marketing. And at the age of 27, or was it 28, one of the two numbers, 27 or 28, I realized that I wanted to build applications. I didn't know they were called startups. So my idea was I'll build applications like Steve Jobs and Bill Gates and them. And that was my dream as a young boy. I then learned that tech ventures are called startups, right? So I started understanding the startup landscape and so on. And how I got to patient care was during the COVID-19 pandemic. I'm surrounded by doctors, and I was seeing how the doctors were consulting on WhatsApp and also giving prescription on WhatsApp. So in reality, there was already a market space, ecosystem, self an entity of its own where doctors could actually use WhatsApp to consult patients via video call or even voice call. So the only problem I had with that was that you as a patient, you do not have your data. You don't have your history. You'd receive this WhatsApp prescription, you'll send it out, the pharmacy will deliver it. However, it will eventually disappear somewhere, somehow. As you know, WhatsApp, a clutter of information, but no organization. I then started talking to doctors, pharmacies, and health insurance companies about this digitalization of the ecosystem. And many found it to be interesting, and my team and I then decided, hey, let's build this application and see where it goes. And today we're in Namibia currently, obviously home ground, and we've also started engagements in Nigeria. We started engagements in Kenya and Botswana, and we've got a total of 750 healthcare professionals on our platform. Also,
Wow.
we've launched the beta version last year, 7th of June 2024, and now we'll be launching the what we call the scalable version. Coming out the first week of October 2025. So
Wow.
patient was really built due to observation and also understanding the customers, seeing what the ecosystem is doing, seeing what the patients are interacting and their struggles. And
Mm.
we learned that we needed to connect this to some form of health insurance as well, because the reality is over 600 million Africans do not have health insurance. In Namibia and South Africa, it's called medical aid. In the rest of the world, it's called health insurance. And Botswana. Botswana also calls it medical aid. So it's a Southern African thing, medical aid, this term. But it's the same as health insurance. It's the same. In Nigeria, it's called HMO, but that's the same health insurance. Yeah, so we then went into the journey to digitalize the healthcare industry in Namibia, and it's taken us so far, which is pretty exciting.
Yeah. Wow, that's amazing. Like I love your story. Like, you've said a lot of things on the line in course of you narrating your story of how you had to come back and then you saw the reality of things in the African market and then you had to create an opportunity for yourself by, creating a brand and starting something up and then you observed, right? I think, it's for me as a healthcare professional, whenever I see somebody who does not have a healthcare background solving problems in healthcare, it challenges me. I'm like, oh, all these computer scientists, they think they can change the world. But yeah, it's really, really inspiring to see that you actually thought about how your skill set can actually contribute to solving actual problems that we have in the continent. So I really want to commend you for that. I mean,
Thank
obviously,
you.
like you said, in the course of the pandemic, there were a lot of, realities that, a lot of us saw: lack of data, lack of, organization of data for patients, and not even understanding what is even happening in the landscape as a whole. So I'm curious to know what were those big problems you saw aside from just the data aspect that you felt like you could come in to solve for.
Well, many Africans find themselves in America and Europe, right? And the reason for that is better opportunities. Now, I learned that doctors that work for the government are not allowed to do what you'd call a hustle or side job, right? And they would be doing these consultations on WhatsApp for free, literally for free, at no cost. So one of the problems of solving that area is more income for doctors when they're consulting in their free time under a regulated body. So doctors can actually earn extra income in their free time if they have a full-time job. If they do not have a full-time job, the other problem is it's expensive to start your own practice or your own clinic. It's pretty expensive. You need all this technology and infrastructure and so much expenses from day one. So with patient care, we can give doctors this ability, or health, not only doctors, healthcare professionals, pharmacists, nurses, physiotherapists, you name them. We give them the tools to consult patients or even visit a patient at their home. And at the same time, they can earn and make more revenue with us. Those are one of the problems. The other problem is pharmacies are great and beautiful, but the problem is that they're not digitalized. So you can send your prescription via WhatsApp and the pharmacy will deliver this because on WhatsApp you can drop your PIN or your location PIN and you can provide your name and the pharmacy can go through the system to see if your insurance number or your name makes sense if it's on the system. And if it's on the system, wonderful, we'll deliver the medication. However, they are not digitalized. So what I mean by this is, again, to start a pharmacy, it costs you a whole lot of money. And Africa is a continent of young people. We don't have that kind of money to just start a business. So it's difficult for them to just become entrepreneurs or businesswomen or men. So with that, patient care is now digitalizing them, and we've created an e-commerce model for them. So the problem for them is startup capital and a platform where they can sell their prescriptions and medication online. And we've provided this service for them. The other is our nurses. We've got a lot of nurses and nurses with wonderful skills. However, lack of jobs, not too many hospitals and clinics to take on these nurses. The other is nurses that are midwives. Where do they find their clients as well? Nurses that can clean up a bandaged wound or something, or bandage a wound like an open wound the patient needs to go to the hospital so that this wound is cleaned up. Why not the nurse come to your house, basically? And the other problem that we looked at is the high uninsurance rate. Like I said earlier, Africa got 600 million people uninsured. So just looking at Namibia itself, 82% of the nation is uninsured. That's about 2.1 million out of our small population of 3 million. With that said, we've created a unique health wallet where an employer can buy some health units. We've kind of used the blockchain technology to do this, where you can buy tokens and these tokens act as an insurance. And I'm putting this in inverted commas because we are not allowed to use that word. But nonetheless, we've created a system where it's tokenized and you can then buy health units for your employees, your domestic worker, your security guard, and even a family member that one takes care of. As we know, black taxes is a global thing, not just an African thing. So, yeah, so those were the problems we started looking at, and then we started building solutions for each problem. And we also started working with the healthcare professionals because, again, it's the healthcare industry. Like, what is a computer scientist doing in the healthcare industry? So definitely
Very
work
real.
with definitely work with healthcare professionals in the area. And when we're doing pharmacy, we work with pharmacy, like a pharmacist. When we're doing doctor, we work with a doctor. When we're doing nurses, we work with a nurse. We have a structure, and we've got some partners that help us as well, which is fantastic. And we've got a co-founder that's a doctor as well. So she brings in that expertise. The one thing I needed to do from the get-go was build a team. Again, I'm a techie. What am I doing in this industry, right? So we needed the right team. We needed the right team members. So I found a good friend of mine. His name is Philip. He does our technology. He's a CTO. He's our CTO and co-founder. And then we've got Dr. Suraya. She is our co-founder as well and CEO. And she manages and advises on all the health related stuff. I'm the CEO, but it's my innovation. However, it takes a village to make it happen, right? So
Absolutely.
I have the vision for it, and the team has taken the vision, and now we're growing it together, which is pretty cool.
Yeah, that's such an inspiring story you shared. Obviously, like, back then when I was from school, I was very annoyed. I was like, you these computer scientists, they feel like they can code. They just come and take our startups and, build things in Africa. But it's amazing. I love the fact that you said it takes a team actually to build, something sustainable and something that actually will save lives. So, I mean, the problems you highlighted are very real. Like, there are things that actually not just unique to Namibia, but unique to almost all countries, not just even in Africa. So I love the fact that you mentioned that, we complain that we don't have healthcare workers, but even the ones that we have, some of them still don't have jobs. Some of them still are looking for opportunities to be able to serve and put their skill set to use. So in your opinion, how do you think that, technology has, come in to like support this kind of, healthcare workers? And do you see that, I mean, comparing from what you saw in a couple of years pre-COVID and now, how do you see technology evolving the way healthcare is going to be used? I mean, how patients will be able to access care. Your startup is patient care, right? And I love that, because the name actually sounds is resounding. So how do you think that pre-COVID and now, what has been the difference you've seen in terms of how technology is being used to, administer care to patients?
I can summarize it with one word before I give you like a whole story.
Okay.
Access. Access to
Yeah.
healthcare has been much easier because now it costs you less to see a doctor or a healthcare professional with patient care, and also the healthcare professionals make more money. In fact, we thought that they would be making less. We thought our assumption was that these healthcare professionals, or the government job they have, or the private job they have, will be paying them much more than what they will be making out of our platform. But it turns out that they make much more. They make it about 30% more on our platform. So if you take their salary plus 30% of that, that's what they take home with patient care as a healthcare professional. And as for patients, we reduced the cost to see a doctor by 80% in Namibia. So what that means is you do not no longer need 500 rands or 600 rands or Namibian dollars. All you need is 150 Namibian dollars or rands. And you cannot access a doctor. And anyone can get access. Anyone can reach 150. I mean, 150 is like it's For someone to tell you that they can't get 150 to see a doctor is quite impossible, actually. So we've made it accessible. And not only that, instead of you waiting in long queues or waiting in the clinic or going back to the clinic for 2, 3 days in a row, simply because you haven't been seen in those previous days, on patient care, you can be at your home, book a meeting, or even find a doctor online or a nurse or a pharmacist online. And within a few minutes, you're well taken care of. The only downside we see with technology is the physical touch and your senses. So using those 5, 6 senses to actually see and diagnose a patient. And what we've done is we've brought in artificial intelligence, AI. However, we're not replacing doctors with AI. We're using it to make their lives easier. So we're using AI to gather data from the patient. So be it your symptoms, be it your history, be it your previous prescriptions, and so on. The AI in our system just summarizes that for the doctor, basically. Whereas in the pre-COVID or before COVID, you wouldn't even have access to your personal file or your medical history unless you have a hospital card. So I think technology is making life a whole lot easy. And what we're trying to do is make it more accessible to everybody. It is a mission. It is quite difficult because the older generation don't really appreciate it so much. The older generation still wants to be going to the clinic and being seen and touched. But the millennials, the Gen Zs, the younger ones, our generation, they love it. They appreciate it. And I think technology is just here to help, not replace. Eh? And like we said before, there are nurses and healthcare workers, doctors that do not have jobs. I mean, USAID left the continent or left Namibia. Let me just speak of Namibia. A lot of a lot of healthcare professionals became unemployed. But now with patient care, we can still close that gap for them, and they can now treat patients and still have stable income. So again, I think technology is on point. It really depends on how you use it as well. If we say that we're going to use artificial intelligence to replace doctors, now we're speaking the wrong language here. That's not how it goes. We
Absolutely.
can't replace pharmacists. We can't replace nurses. We can't replace doctors. It's impossible because it's humans. However, we can make their lives easier with technology. So I think that's what we've done. After COVID, I think technology is moving in that space. And it's nice to see, it's beautiful to see a patient drop a review saying, I managed to see the doctor, or I managed to get my daughter sorted out or my son sorted out, and I didn't need to leave the office. It's beautiful. It's actually what drives me, the feedback from the people. Yeah.
That's amazing. I love your story. I love how you've highlighted how technology evolved and also the adoption, right? Between the difference between the generations, the Gen Zs, millennials, and the older generation. And I think that's one thing that, I've struggled with as a person, as somebody who has, designed healthcare solutions, technology product, is really thinking about we have this hype in the African continent for technology and the use of technology for healthcare, but actually are this really solving problems? So, and I'm glad to hear from you that you actually have real results, real metrics to say that okay, 30 doctors and physicians who use our platform earn 30% more, than their actual salary. That's a great statistics to start with, honestly. And I feel like there's going to be definitely an adoption that will shift in a couple of years. Might not be immediate because I feel like one of the things that actually made the adoption of health tech increase was COVID, because people realized that they can't go to the hospital but they still need care. But in the next couple of years, I'm very certain that the adoption rate for technology in health is going to increase. Recently, I mean 2 days ago, I was at a conference, I was a summit at Hopkins, for AI and health, data science for tech for healthcare. And they were talking about how the trust and the adoption, like there's a high adoption and low trust, for technology. I don't know if you have anything to comment on that. Do you think that patient trust technology, particularly now that we are infusing the use of AI in some of these, innovations? How do you think that, do you feel like, patient trust this technology to be able to deliver their care? And I'm not just talking about logistics, even actual diagnostics, right? From your experience, how you say you've seen this happen?
Right. So I think it's a personal type thing, right? Some people appreciate it, some don't. I'll give you an example of a patient we've seen. She needed therapy, but she didn't want to go into the clinic, the practice, because she didn't want the receptionist to know her problem. And again, Namibia is so small, so everybody kind of knows everybody. So she felt comfortable using technology because it was directly with the doctor and it was private, like in a sense of she didn't need to reveal issue to everybody in this if it were to be in person. And then you have those that say no, I prefer seeing a doctor and I prefer being touched by a doctor and so on. So again, it really depends on people, right? We've seen employers appreciate our technology because it reduces absenteeism at work, as an example. Before technology, when the employees needed to go, when the employees were sick and they needed to go, when they needed to be seen by a doctor or they needed to book themselves in the clinic, they would be 3, 4 days out of work just because of that, right? So because of technology, the absenteeism is reduced simply because now it's much quicker to access these professionals.
Yeah.
I think AI is a bit scary, to be honest. Having robots cut you open and stitch you and all that, no emotions, no human touch. But at the same time, it could be more accurate as well. There could be better results too, right? So I'm really on the fence with that. Still, I'm not too comfortable with that, and that's why we are only using AI for our symptom check and our KYC compliance and a few other areas, not really replacing nobody. But yeah, we've seen people appreciate it, and we've seen people say never use this, and that's okay. We work with those that appreciate it, right?
Mhm.
Yeah. So that's yeah,
I
that's
think it's a consumer behavior. Yeah.
yes, you're right.
I think it's a consumer behavior shift that would have to happen, it's take a while, but it's definitely going to happen at some point where everybody gets comfortable using technology for health. But I mean, great success story there in terms of like how you've been able to support patients get care. I mean, just using my own example, I have a family member who had to like go to the hospital, like you said, because she had like a follow up to go and see the doctor to show the test results. Like she went to the hospital, the the doctor was not available because of long queue, and don't like she even actually got there late. She got there very early, like 6 a.m., but then there were a lot of people, backlog of patients who wanted to see a doctor, right, just to just consult. And one, not just once, twice, 3 times. I was like, what's happening? Like, it takes 3 months to show your test result to your doctor to actually get a prescription or a drug to use, and that's actually not really cool, right, in this age
No,
and time. So what you're doing with patient care, I must say, is very commendable, because you know we need to move past that. Like, just to see a doctor to show my test results shouldn't take me 3 months. What if it was a critical condition that I needed care for? Like, how would I have manage that condition? So definitely technology must somehow come in to fill that gap that we are seeing in terms of like patient accessing care. Yeah.
yeah,
Thank you. So yeah, so I mean, I would like to understand the market in Namibia as a whole, right? So maybe we'll just like talk a little bit about Namibia. I'm very curious. I know you said you came back to Namibia, but can you like tell us why you chose to build in Namibia, and also what's the market like in Namibia, like the healthcare market? You said a number of things already, like the insurance and all, but because you just walk us through, like, what does the healthcare market like look like in Namibia?
okay. So why Namibia? I don't have a choice. I love you. Just
Yeah.
it's home. It's first place that I thought of. I love here, right? And I think it makes it's a great place to test because of the population size. If it works here, 9 out of 10 times it will work in South Africa. And if it works in South Africa, 9 out of 10 times it will work in Nigeria. And so the story goes with Africa scale. So yes, I love here. What's the experience been like? I mean, the reality is that Namibia and what I've seen in other parts of Africa as I traveled, the problems are quite similar. The problems are the same. Malaria, taking lives, HIV and AIDS taking lives, TB taking lives, diabetes taking lives, and The problem is lack of medication, lack of awareness, lack of education, lack of understanding. What do I eat if I have diabetes? Or what do I do if I get infected with malaria? New mom just got a baby. What kind of vaccinations should she give this baby? So the baby can make it into toddler and then become an adult one day. It's very similar problems all across Africa. So Namibia has these problems too. And I think the way to solve it and the way to like close the gap is if there were more entrepreneurs to solving or fighting this problem. I'm of the belief that we at patient care will probably only solve 10-15% of Africa's problem. We need more. So the problem is shrunken.
Yeah.
There's matters of education, there's matters of awareness. Where do I go when ABCD happens to me?
Mm-hmm.
Uninsurance rate. Let's just look at some numbers. Nigeria is at 97%, all-time high. South Africa is at 84%, and then Namibia at 82%. And I think and Botswana at 80%. So I think the smaller countries are kind of getting it right. I mean, if you look at
Mm-hmm.
Africa, you'll know that Ghana got it right and Rwanda got it right in terms of reducing this uninsurance number and also educating the people and so on. And many other African countries are yet to get there. Not that they won't, I believe they will. There's a lot of amazing startups around, especially
Yeah.
Nigeria and South Africa, amazing startups. I just feel that the government should be involved as well. When looking
Absolutely.
at Rwanda, the government was highly involved. When looking at Ghana, the
Mm-hmm.
government was involved as well. So I think the government should also be involved so that people are more educated. And I think the biggest problem is just education, to be honest. I think that's the biggest problem. You ask someone, why don't you have insurance? They don't even know why they need insurance to begin with. They will tell you, no, it just takes money from me. I need that money for ABCDFG. They don't know that they could encounter a huge problem 3-4 years down the line, and then insurance could be the cushion to land on. So I think it's just really education. I mean, Namibia faces the same problem. When you talk to the healthcare professionals here, you hear them say people with diabetes don't know that they shouldn't be drinking Coca-Cola. And you're like, excuse me, I don't understand. You have diabetes when you're drinking Coke, make it make sense. So yeah, I think that's yeah, I think I've hit the nail on the head though, because education is the center of it all. And
Absolutely.
again, how we're trying to solve this problem is by creating educational platforms. It's
Mm-hmm.
costing us a pretty penny, but we hope that we'll find the right sponsors as we grow. Now, looking at Namibia, how has it been? I think it's been pretty smooth, to be honest. I've seen startups try to close partnerships and struggled. We have not struggled. It
Mm-hmm.
sounds kind of arrogant to say, but it's the reality.
What's
It's
your
the
hack?
truth.
What's your hack there?
It's the truth. You walk into a room with a partner or potential partner and you share the idea or the concept and you share how it benefits them and benefits everybody else. And we have not received no's. We just yes, 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 let's do it. When are we starting? Is it ready? Can it do A, B, C, D, F, G? Those are the only stuff we hear. And it's really, really exciting. And the same goes for the partners abroad. I mean, we have partners in Nigeria. Just to boast a bit, we've got Flutterwave backing us up as well, which is nice.
Mm-hmm.
We have partners. We're now going to be getting partners in Kenya. We started these conversations about a month ago. The partners in Namibia are like the biggest companies. One of them is $1 billion company. So it's been a nice journey. It's been exciting. I think as a startup founder, the difficulty comes in when you get rejections. I think that's where you need to have like thick skin because the rejections can demoralize you. But in our path with patient care, we haven't experienced this yet. And I'm not looking forward to any in the coming future. Um,
Wow.
yeah, pretty
That's
much.
interesting. That's interesting to know that you've not received any rejection so far. Like, what's the hack? Like,
None.
We need to come and learn from you in terms of how you have, survived in terms of like striking your partnership. Maybe there is something you're doing that most of us need to learn from. But
Maybe.
great insight there in terms of the market. But I feel like what you've said is very, very real, right? In terms of like the challenges of the market and how similar it is across the African market, like the percentage of uninsured patients. I think this is an area, it's not just a startup thing. It's not just about you as a startup founder, but actually the government have to collaborate with you. I feel like there should be a forum where, we have the government officials, we have the startup founders come together, and then we sit and discuss how can you support startup health tech founders who are like doing something in health tech, and help them to do better, because you're actually helping them. The government
Mm.
hospitals and facilities cannot make sure that patients are alive, or we have a lot more healthy population that's able to do work that will benefit the economy. So I love how you talked about Namibia, and how you started from a place where you feel like it's easier to demonstrate evidence and also skill to like other market, which is what you're currently doing. Yeah, but I mean, it's really interesting and beautiful to know what you're doing in Namibia. Maybe let's hinge a little bit more into patient care as an organization. I was actually very, very, excited about what you're doing, because I see that, as a health tech founder, right, it's really not easy to even build one health tech solution, right? Say you are doing something in pharmacy care or patient access to medicine, but you are not just playing in one aspect of, health tech. You actually like doing a lot. You're in the patient telemedicine, you're in the medicine access, you're in the, all of these things. How have you been able to manage, all of these different solutions? Because your solution looks like a super app that is doing health insurance, you're doing health diagnostics, you're doing access to medicine. So what have been your hack in terms of like managing all of these, and what are some of those challenges, like real life challenges you faced in terms of driving adoption for these solutions in the continent of Africa? Because I feel like Africa market is very different from other global markets. Like we talked earlier, the place of trust, the place of being able to use technology and all of those stuff. So yeah.
Indeed. So goal is to build an ecosystem. Um, I
Okay.
try to stay away from the word super app. It makes investors nervous and partners. And it makes me nervous, to be honest, because super app sounds like, oh God, Superman or something. It sounds a lot, actually, when you use that word. For me, I like the word ecosystem. So we're building an ecosystem. And how we're doing this is we've centralized the health wallet. So the health wallet is a center, and then everything else is around it. The telemedicine, the pharmacy, and all these other nice stuff. So we've put all of this in a mobile app, Android and iOS, and now we're also going into USSD for those that do not have smartphones. And I mean, it's not been that difficult, to be honest, because once you've got your telemedicine functions going, you've got all the data sets and the data nodes and all this important stuff, and how the money moves from point A to B, and or point A to B to C. We then tackle the next one, which is pharmacy. Once we're done with that part, we then tackle the next one, which is the nurses and the ambulance and the labs and the hospitals. So it hasn't been that difficult, to be honest. It is hard. I mean, it's not never easy to start a business or to build anything. It's very difficult. However, my main strategy was always find the right partners, the right people. I believe in people. Personally, I believe I'm a human being. It doesn't matter if I have $1 million or $1 in my pocket. I'm a human being, right? So that's my first point of that's how I move in life. Because of that, I believe in people. So if you're doing something in the pharmacy space, let's go talk to a pharmacy guru. If you're doing something in the nursing space, let's go talk to a nurse specialist or somebody important, someone with the right knowledge. And the same with the doctors. Like, for example, just to share how we got to 750 doctors. We got one doctor in Namibia, then one Namibian doctor brought 20, 20 brought 100, 100 brought the rest. That's just how it went down. And if you look at the pharmacy, same situation.
This is a very interesting conversation on how, as health tech founders, we are actually solving real problem. But I believe so much that, even as a health tech founder, there needs to be like some form of strategic partnership between the government and the private sector players, which are the startup founders. Because this we're actually solving real problems, but we can't do it without the infrastructure, the policy, and the regulatory landscape that provides us the opportunity to be able to save lives. So I just want to commend all the health tech founders. If you know any health tech founders, you should give them a thumbs up because they're actually saving real lives. Today's conversation is really about how you scale access for medicines, access for healthcare to patients who actually cannot afford them or who need better care. And today's founder, Jessé Liula Schiceya, is not just playing in one market, it's been in many markets, but not just even in markets. I'm also talking about different fields of health technology and how you adopt health tech. So great work. I'm very excited. HSB Global, we are here to support healthcare businesses, startups, organizations, and parastatals to be able to support them in driving healthcare solutions and streamlining their operation to make them succeed. They actually have to succeed in running their healthcare business. Once again, my name is Ezinne Aso. I am the host of the HSB podcast series. Thank you so much.
As mentioned, and it's easy because I work with people and I trust people and I believe in people. So what I'm saying is, if we're doing pharmacy, or work with a pharmacist or someone with an MBA or master's degree in pharmacy, or even someone with a PhD, because they can get that extra research and knowledge. So it's been easy simply because we work with people. I don't think I know it all. I'm not. That's not me. I believe that I only know what I know, and I need my cup filled every morning. So wake up with an empty cup. By the end of the day, my cup should be filled with knowledge. I'm glad and blessed to have these people around me, and I'm always looking for more people to help out. The reality is, yes, we have pharmacists for Namibia, but what about Nigeria? What about Kenya? What about Ghana? So, yeah, that's how we're doing it.
That's amazing. Yeah, we had a podcast series like last 2 months ago where we talked about inclusive partnership and how to be able to build anything sustainable in healthcare, you need to depend on partners, be it private sector, be it entities in who are professional workers, government officials. So yeah, it's really really important that as health tech founders we see the importance of partnerships, right, in
Mm.
anything we are building, right? Because that's the only way you can scale and do something stronger. Yeah. And so I think just to wrap up, we'll just ask, patient care is doing a lot right now. What's your vision for the brand in the next say 5 years, 2030 when we are reaching out to you to see where patient care is, like what's your vision for the brand and how do you think people can support that vision? Yeah.
In the next few years, we're looking at building a clinic and hospital here in Namibia. And the reason for that is we would like to have our affordable pricing in clinics and hospitals. I can't negotiate with the current infrastructure. Also, they have their expenses, so they can't reduce it. Therefore, we can build something modern, something that costs less to utilize, meaning a patient can actually come in for the prices that we do ask, which is 150 to 200 Namibian dollars. Looking at and that's just for Namibia. Looking at Africa as a whole, our vision is to improve health education and mental awareness. So mental and health education, and also ensure that we reduce the uninsured gap. If we can reduce the uninsured gap of Nigeria by 5%, we would be so happy. And as I said earlier in the beginning, 600 million people are uninsured. Therefore, and that's Africa. Therefore, if patient care can reduce that number by 100 million Africans, 200 million Africans, I think I think I'd die a happy man.
I love that. I love that. I love that. I love that. I love when people, say things that are very, ingrained to their passion, and what they really want to do. So, yes, that's a big problem. And everybody who is doing something in healthcare actually want to see that number go down. So, thank you for sharing that vision. How do you think that, we can reach out to you if we want to reach out to you? Like, where can we find you? Can you tell us your social, where can we find you, support your vision, or even be a part of what you're building in patient care?
Thank you. So we can be reached on social media. We are on TikTok, Instagram, Facebook, and LinkedIn. Our tag is just patient care, one word. Sometimes patient care NA for Namibia. Um, we can also be reached on our website, which is patientcare.care. So again, one word, patient care, and then a dot and care. We don't do .com or .io. We do .care.
Yeah.
Hopefully, when whoever reaches me, our office administrator will get this message, and she will then connect whoever to the right channels, be it me or the other two co-founders.
Awesome. So yeah, thank you so much. This has been a really great exposition to not just Namibia, but also the healthcare market, the challenges, the opportunities, and what you're building in patient care. I must say it's very commendable. It's needed, right? And like you said, we need more people in this space who will come to solve problem, because every day patients are
Sure.
dying because they have not seen a physician, or they have not seen a doctor, or they don't have the right information about their ailment or their disease conditions. Doing it's not easy to build a company, but a company not just in one country, but like in multiple country, solving different problems. So yeah, definitely, we are excited to hear about your journey. I want to ask you one last question. What is that
Yes,
quote
ma'am.
that keeps you grounded? What's that um, favorite quote of yours that keeps you grounded when you feel like giving up, or when you feel like, what's that thing that keeps you grounded to continue to build in
Got
health
you.
tech?
It's always do what you say you will do.
Always do
Very
what you
simple.
say.
Always
Short
do
and
what you
simple.
say you will do. Very simple. If I say I'm going to build it, do it. If you say you're going to do something for someone, do it. Yeah. So your mouth and actions must be connected.
I love it. Very short and sweet. You only think you are going to give one very inspiring Aristotle quote, but do what you say. And I love that. I love that. Thank you so much for sharing. Thank you to everyone who's going to listen to this podcast series. We've learned about the market in Namibia, and also what patient care is doing. If you want to be a part of what he's building, please reach out to him. I think he's very, liberal. Like he said, he's big on partnerships, so he's looking for partners, not just in Namibia, but all over the continent. So if you feel like you have something to offer to patient care, or if you feel like there's a synergy with what he's doing, please reach out to him on his social media and patient care media pages. I'm sure you have access to him. Thank you so much, Jessé. This has been a very wonderful conversation. I enjoyed it, just even listening to another African leader who is doing great work in building for patients and helping people live better, healthier life. I'm very excited, and thank you for honoring our invite. Thank you so much for this opportunity to learn from you. And thank you everyone again. This is the HSB podcast series, a market and startup podcast spotlight series, where we've talked about the markets in Namibia. Stay tuned. We're going to bring more markets. We have 298 global markets. We just got started. So you're going to learn more about other markets across the world and how you can support the healthcare system in that market. So thank you again, Jessé. I don't know if you have any last word, or if you want.
For me, I'm really grateful for you, and may God continue blessing you. Thank you so much. I
Yeah,
really
thank you,
appreciate
Jessé.
this.
Have a great one. Bye.
Awesome.